Hello and welcome back to the Digital Health and Wearables series. Today I have another magnificent guest for you, another leader. But before introducing this week's leader, I'd like to remind you to share this magnificent content with your communities in healthcare and also subscribe. And let me acknowledge also our partners, the series partner VMware and our global partner Spirit Digital. But today it gives me great pleasure to introduce you to Jane Sarasohn-Khan. She's a health economist, advisor, trend weaver at Think Health and Health Populi. Jane, how are you?
I'm so well, and I'm glad to be on this side of the pond with you, closer.
Fantastic. We were talking before the recording that we feel like we know each other for a long time. We follow each other's work. So I'm delighted to have you here.
It's wonderful. Thank you for inviting me on.
Brilliant. Thanks for taking the time. And the kind of subject, sometimes I'm very flexible, but the kind of subject that we're discussing about the health, the health citizen beyond the pandemic and how the digital DIY can address that and help saving healthcare. That sounds good?
Absolutely. That's where I'm spending a lot of my time right now.
Brilliant. And the first question, Jen, that I have for you is, what is this health, pardon me, what is this health citizenship that you talk about so much, and why is it important right now?
Yeah, it's important right now because of coming out of the pandemic, which is now sort of endemic around the world. We've learned so much. So before the pandemic, throughout most of the world, most people had access to some sort of health insurance, whether a model of total single payer care like in the UK where you are, through the history of Beveridge introducing taxpayer funded healthcare for all, or through, say, the Bismarck kind of system, which came out of Germany, which is a mixed public-private system. Around the world, we see flavors of that mixing public and private together. The US is one of the few places that doesn't have guaranteed access for all. So it's a patchwork quilt. And that concept has bothered me since I was pretty young and figured that out in school and then in graduate school. So I came to health citizenship as a concept in the late 80s, early 90s when I married my husband at the time, who's still my husband, working upstairs right now. And I lived in London, worked with Touche Ross, now Deloitte, and came across a chap working in the European Union called Jean-Claude Healy, not Jean-Claude Keely the skier, but Jean-Claude Healy. He was the head of bioinformatics for the whole European area. And Jean-Claude talked about the health citizen way back then in 1990, 1991. And I was really intrigued with that concept. It sounded like something my father would have talked about, who was very active in the 60s with civil rights and things. So that kind of stuck in my brain for many years. And then about 5 years ago, I became an Italian citizen through my husband's grandfather's immigration to the US. That's a long story, but it's real. I have an Italian passport, thus an EU access, which allows me to work here and live here. I became a health citizen like that the minute I got the passport, with access to healthcare and, important, coverage of really good privacy rights through the GDPR. So when I think of a health citizen, it's having access to healthcare for all. It's being covered for my privacy and digital privacy. And then it's a sense of community, living in a place that cares for caring about all people, regardless of race, ethnicity, income, education, gender, sexual orientation. I get that here by regulation. I'm a health citizen, but when I go home, it's like a bipolar life, home to the States. I am not a full-on health citizen. And so I decided to really become more active in talking about why that's important, to reduce healthcare costs, ultimately, to have a more civil society, and ultimately, in the case of a pandemic, to address a public health crisis holistically, which no country got it 100% right, not even New Zealand, but some countries got it better than others. So I'm really keen on this concept of health citizenship to move forward to build and reimagine, or as Biden would say, build healthcare back better, because we have that opportunity now with the lessons we've learned in the pandemic.
Oh, fantastic. Jane, thank you so much. I mean, it's a magnificent concept, but also this leads really nicely to the second question with the health disparities that we experience around the world right now, especially with health access and, economic classes. All these issues are bubbling up now. But thank you so much for that. Leading to the second question is health disparities worsen in a pandemic for people already dealing with healthcare and healthcare access and healthcare quality. How can digital tools address health empowerment and help mitigate the risks of social determinants of health?
Right. This is such an exciting time because of digital health, and not just technology for technology's sake, but how can we leverage it to benefit the most people and to scale. Digital allows scale if we design it right and we have that intent to do well by doing good. And I believe that's true. I work with clients who do that, who can make money and scale. When we think back to the history of economic growth, say in India, when I was in graduate school, I read a book by C.K. Prahalad at University of Michigan Business School called The Fortune at the Bottom of the Pyramid. The bottom of the pyramid is broad, big, and if we design for the bottom of the pyramid at a good value price, we can do well and do good. We think about what Walmart does. Walmart addresses lower to middle income citizens, consumers, and others who want a good value. So this concept, I think, it can really be usable when we think about digital health and scaling to people who really need it and are underserved. We know the numbers from Rock Health, from Galen Growth here in Europe, from Triple Tree, of all these great digital health investments to the tune of millions and billions. We know the concept of unicorns in digital health, but not all unicorns are built to serve the underserved or are designed even to serve Main Street, let alone Wall Street. So we have to think about leveraging digital health tools with good design in the eyes of the user, whether it's a woman or a man, older or younger, people who are fragile and frail, who can't move about easily, who have eye issues, especially older people. So I'm really excited about the prospects for incorporating user design thinking, like Bon Ko talks about. He's in my hometown of Philadelphia at Jefferson, but Bon Ko recently wrote a book on design thinking in healthcare. My friend Johan Sonnen in Cambridge, Massachusetts talks about it. And then I also think about open code and democratizing data, which here in Europe, Bart DeWitt is working on in Germany. So there's a universal tribe of people who are thinking about this, even going back many years to Todd Park, who talked about data liberation when he was working with the Obama administration on healthcare data liberation. And now, of course, is a founder of Devoted Health, which just garnered over $1 billion in funding in the last 2 days. So anyway, Todd's liberating data to serve older people in Medicare Advantage. We can do that with good data, respecting data from all over the place. So I think about the plumbing in digital health, which isn't the sexy part, but it's the part that helps us get data together, mash it up, move it where it needs to go. So I think about companies like Validic and Zelf. Neither is a client, so I'm going to name them, but they're working on moving data around, putting it together, and then serving up on platforms the ability for clinicians to prescribe food or order goods off of some e-commerce site, say Amazon. And then I think too about the prospects for Amazon and other e-commerce to deliver goods and services to people at home, through their hand, through their phone, or a computer for things like food, because we saw in the pandemic nutrition as a social determinant of health being a big challenge for people who lost jobs or who didn't have food in the first place, and it was exacerbated, supply chain problems, etc. So I think we've got the opportunity to leverage digital health with good intent, good design, and good data hygiene and fairness.
Oh, fantastic. Jane, fantastic insights. We could spend hours just talking about this. It's so much, but you highlighted the importance, of course, of digital health to be leveraged in the right way to impact more people in other words, but also other issues, the democratization of healthcare, the consumer, the open data is so much work to be done. And let me congratulate you also on your work, magnificent content, and also on your voice, because you have a really, a clear voice and a very genuine voice around it. So fantastic. And I'm delighted to have you here.
I'm delighted to be here and so much fun to share time with you. Wow.
And we're talking about remote monitoring before. I'm heavily involved in digital health, and the time is right. I don't have more questions. I'm going to wrap up. But Jane, I finish all my episodes in a peculiar way, which is not a question as such. Is 1 minute of fame. You can mention anything, personal achievements, family, companies, a shout out, your work, anything whatsoever. So before I round up, 1 minute of fame, over to you.
Thank you. Well, yesterday or Sunday was the International Day of the Girl, which I didn't know existed. So now that I'm in the EU, I'm getting access to all kinds of new things and a lifelong learner. So I was thrilled to see that. I have a daughter, Anna, who's a digital designer. So she's carrying on the ethos with her work. And shout out to her and the good work that she's doing. But also let me lean over and grab another girl that I have, a little Lego girl who from the chest up looks kind of like me, from the Lego store. And my husband bought me an Elmo keychain at the Lego store here to put on my new apartment keys. So I'm a Lego maniac, as is my family. And I want to give a shout out to Lego, whose mantra is play well. Leg godt is the Danish for the translation of play well. And I think now we have the opportunity to play well with each other. Lego came out today with an announcement on doing better design for gender equality. And they just came out with a set that I bought before I left the States for LGBTQ equality, sort of rainbow minifigures, which I love, which is on my desk at home in Philadelphia. But for now, she's with me representing equality and goodness. So I want everyone to play well with each other. I'm delighted in Brussels. People are largely masked. There's a civil society here. I couldn't be more delighted to be living in a health community like this.
Jane, what a way to finish. Thank you so much. And I want to thank you for your time, for your expertise, the great insights. And you are so creative and such a great thinker. The way you finish it tells it all. So fantastic. Thank you so much.
Thank you, João. I'm so glad to be near you now.
Brilliant. I'm going to round up now to all our users and viewers and the listeners. Make sure you subscribe, but also connect with Jane. I'm going to post Twitter and LinkedIn here. Follow her great work. And let me finally acknowledge our partners, the Siri partner VMware and the global partner Spirit Digital. And I'll see you all next week.